And we are live, people. Kia ora to the people joining us. We're going to wait a couple of minutes as you come in. It is a glorious day here in the Tairāwhiti, as it is regardless of weather. I hope that you are doing well wherever you are. I'm going to wait one more minute. Kia ora, Jerry from Te Muka. Feel free to introduce yourselves in the chat and where you've come from today. Our panelists will be able to see that, even if we can't individually do a shout out to all of you. Awesome. Kia ora, Rosemary. Kia ora, Val. See, look, I'm totally going to. If I see your name come up, you've got half a minute. Kia ora, Catherine. Okay. I'll know my haramai. Kia koutou, ko tai mai nei ki te tautoko o tēnei kaupapa. Ngā mihi aroha kia koutou. Ki ngā rangatira, e tū mai nei, kia Doctor Who, kia Rawari, kia Boyd, nau mai haramai. He kaupapa taumata tēnei. Ko Elizabeth Kerekere toko ingoa, he te taha o toku pāpā, he uri o te Tairāwhiti, ko whānau ākai, ko Ngāti Oneone, ko te aitanga maha ki rongo whakātani ngā tāmanuhiri, ki te taha o toku māma, no County Clare, County Tipperary ki Airangi. And I am your host today. I'm a Green Party MP. I feel like it's just, I'm just an activist, just doing it in the big house now. And our goal here today is to open space and make sure that as many of our people take part in this process. We are restructuring the entire health system. Notwithstanding, they have separated out mental health, they have separated out people with disabilities. Let us approach it in the unified, holistic way we know that needs to happen for the well-being and health of our whānau and all of our communities. So I'm going to let our panel introduce themselves, and we're starting with Rawari. Kia ora.
Kia ora. Ati hei Pae Ora. Ko ue nuku te atua, ko huakai waka te rangatira, ko Waitamata, te moana, ko kaiwhare, te taniwha. Ko whau te maunga, ko huatau, te tangata, ko manuka, te Pae Ora. Ko mātukutu reia, te tumu whakarai. Ko te atai rehia te wahine. Ko Ngāti te ata wai ohua, te iwi, ko te wairua, kei wainga nui ko Rawari rātu tōku ingoa. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Tēnei te mihi atu, ki a koe e Boyd, ngā mihi, ngā mihi, ngā mihi. Ki a kōrua, ngā whaia. Hi pēte, rāwa ko huana, mai oha, kōrua. Dave Ratu is my name. I hail from the original people of Tāmaki Makaurau. And like my our whaia here, and actually all the panelists, a bit of radicals. Mine's around alcohol, so I'm going to leave it there and hand on to whaia huana. Kia ora tata.
Kia ora koutou. Ko wakato te iwi, ko nā te tahinga te hapu, ko werarua te marae, ko whaingaroa te moana, ko karioi te maunga, ko huana hau. Nō reira, tēnā koutou, tēnā tātou katoa. My name is Huhana, Dr. Who for short, my favourite nickname. From the Waikato, Ngāti Tahinga is my hapu, and we're from the Whaingaroa Harbour, Karioi te maunga, and pleasure to be here today. So thank you very much. And I will pass it on to Boyd to kōrero.
Kia ora, kia ora.
Kia ora.
Ahoia no tēnā tātou. Nei e mihi atu ana kia koutou kua whai wāhi nei ki tēnei kaupapa haka hirahira. Ako wai tēnei, ko hau, ko Boyd. Tētahi o ngā uri no raru I te maunga o Ramaroa, whirinaki ki te hokianga. E whakapapa ana hau tonu kia Tainui, kia Ngāti Parau hoki. No reira nei, e mihi atu ana kia koutou katoa. My name's Boyd. I've grown up in Whirinaki, in Hokianga. We also whakapapa to Ngāti Tahinga and Inerupe and Ngāti Parau. And it's a pleasure to be here. I'm always overwhelmed by people that I manage to be on panels with who I see as far superior in their knowledge base to me. And so I love sitting amongst these panels and I use them as an opportunity to learn. And I hope we have some good kōrero today about the Pae Ora bill and Māori health in general. Tēnā tātou.
Kia ora, kia ora hoa.
Kia ora. Amazing. I was so excited when all of you said you could make it to be here today. I'm wondering if we do another round and tell us, what do you think tino rangatiratanga looks like over our own hauora? We're looking at a complete change of the health system. What would it actually look like? What do we need to be in place? And I'll come back to you, Rawiri.
Hi, well, you know, as a lead up to this, and I know I've got a very, very short window of opportunity, but I think that what's important for our viewers to and they probably know this, that for 180 plus years, the health and well-being of Māori have suffered under successive governments. And all the indicators suggest that it's getting worse. The kōrero is not new. Māori know this. And the Crown tends to ignore it. You know, that question about, what is it? Oh, what tino rangatiratanga over Hauora would look like? Hand it back to Māori. Hand it back to Māori. Crown, you have failed. You have failed for years and years and years. And the well-being of our people continues to suffer. You know, we're not mythological creatures. We exist. Our individual and collective experiences as a people, going back to the 1700s and even before that. We all know the history. The Crown and some Pākehā, it's not for you to appropriate and to distort our history. Our history as a people. The time has come where the Crown has to accept the fact that they have failed. They need to now hand back to Māori the responsibility of caring for our own. So what does that look like? Well, firstly, it ain't going to happen. I'm going to tell you that right now, but that will not stop us from fighting for that to happen. The Pae Ora Healthy Futures Bill proposes, among other things, changes that on the face of it will deliver better health gains for Māori. I remain skeptical. Just in the alcohol field that I work in continuously. When the Crown at the end of this financial year can have an income of $1.5 billion from excise tax, $1.5 billion from excise tax, and Māori receive $287,000. Let me say that again. It's not a mistake. $287,000 for alcohol harm reduction initiatives. $287,000. Rangatira Tamati Wakanini once said about tobacco, aren't tobacco companies criminals for making money off our death? I pose the same question to the alcohol industry and this government. And all those MPs in the House, including Te Pāti Kākāriki. And at this point, I need to take my hat off to Chloe Swarbrick, who tried to introduce that private members bill. But, you know, at the end of the day, in fact, you know, when we talk about that quarter around tino rangatiratanga and what is co-governance in health, what would that look like? Well, they really dovetail into one another, it's from my perspective anyway. Give it back to us. Give it back to us. And a good, you know, I think I'm jumping down the track, so I'll stop there because I'm getting on a bit of a roll here. So I'll stop there. No, so give it back to us. Give it back to us. Give it back to us. That's what it looks like. Give it back to us. Give it back to us. Komitsu, at the moment.
Dr. Who.
Kia ora koutou. Tēnā rangatiratanga. It means so many different things to so many different people. And for me as a hawa, as a wahine hawa, that means as a disabled woman, it's been a journey. One of the things I'll share with you a little bit, which should give you a kind of a visual about why it is so important that our health system respond in what I call the re-indigenizing of our health system, which is what I believe is a really important step we need to look towards taking. When I was born, way back in the dark ages, 1962, February, I'll be 60 next year. Back then, they gave babies away easily, particularly Māori babies. They actually, what they did, in my case, is they changed my ethnicity on my birth certificate. Now, my mother was Māori, Navajo, and Aboriginal. They took that away from her and made her white. She was not white. I'm sorry. When I met her, she was black. Okay, and I smiled from ear to ear. Why? Because I felt all of that my entire life, but it was removed. Now, I was born a month preem. The doctors in their wisdom believed that I was going to die. They also placed on the adoption papers that I was an imbecile and an idiot. And this is the type of labeling they placed on a lot of us back in that day. So you can imagine my upbringing, you can imagine, I had a lovely couple that were my adoptive parents, and they've both passed. But when you imagine what that was like, the health system put these labels on people early. And if you were a Māori baby, there were thousands of us waiting to be taken because they never interviewed the Pākehā couple. They were always perfect, but a Māori couple wanting to adopt had to go through a 3rd degree. So it wasn't just that all impacted on our health. If you think it's not health related, move forward a few years and you'll find that there was no history in my birth papers, nothing. I was also exposed to dioxin as a baby on the farm in Taranaki because they sprayed them until 1965 with 2,4,5-T or dioxin as we know it, Agent Orange. And they made it in Taranaki. I have never received ACC for the fact that I was sprayed twice as a baby and that I was exposed to it as an infant and as a young person. So fast forward further, I've been denied justice in the health system. Last year, there was, of course, as we know, a pandemic, and there still is. In 1918, 100 orphans were raised by Princess Tapuia. From within my hapu, my nanny was her close friend. They raised them together. These were the children that survived from parents who died. My wife's whānau, her tupuna was Tauhenare, the MP, and he was told he wasn't allowed on the train because he was Māori to go and bury his wife. His wife was a nurse, Hera Henare. She was nursing in Takapuna and she died of the Spanish flu. They told them, do not open the casket. In their grief, they opened the casket and heaps of them died. That whānau have never forgotten that. The urupa she lays in is called Takapuna. and she was the first to be buried there, and whānau followed soon after. So this pandemic has now come about, and I'm finding we're facing the same attitudes, the same problems. Last year, we lost 7 whānau, preventable deaths in every case, because they live rurally and they live in Northland. One was a cousin. She had a brain aneurysm. They placed her in Auckland Hospital, ICU, told her she will never breathe independently again, will never move, and that if she gets the flu, they will DNR her because they cannot afford to keep her alive. Now, she was starting to speak again. She was having time off the ventilator. She was starting to move with her fingers and signed to our cousin, who was a nurse, that she wanted to live for her grandchildren, for her mokopuna. She got the flu and she died. They killed her effectively last year. Her husband, in grief, who was on dialysis, told the dialysis team, "I don't want any more," and he went off and died 2 weeks later. They did not stop him. They didn't make any attempt to tell him, "Matua, you're grieving, we'll provide you with grief support." He died, and his father died another 4 weeks later. This is the story of Māori whānau. This is just one whānau. This has been replicated. We all sacrificed when everyone moaned about not getting out of MIQ so they could say goodbye to their loved one. Do you know what? I didn't feel sympathy for them. Why? Because I had to say goodbye on a Zoom time after time after time. And I accepted that for the sake of our whānau who needed to be isolated. So now we're at a crossroads. And this crossroads is offering us an opportunity. And it's very simple. Pae Ora is simply in 3 parts. You have the individual well-being, the collective well-being, and the well-being of the environment. How can we as Māori say that's bad? We don't. How can our Pākehā whānau and friends say it's bad? Because it's about the well-being of them as well. This is about bringing us all together and having a wellness model. Now, I'll finish off by just giving you some stats here. 33% of Māori have a disability. 24% is the mainstream population. 68% of Māori from the age of 40 have a disability. Why? Poverty, obesity, obesity because of poverty. Poverty because of the labouring work and the low wages. And many of them cannot work from the age of 40. Most of us don't make it to retirement. Our Hauora services get 1% of the health budget, 1%. We're 16.5% of the population, 1% of the health budget, which is why we cannot get primary health care to meet the needs of our community. So I'll stop there, but this is the reason why I support Pae Ora. Kia ora.
A question has come up that asking about, from Josh, just saying where do we start? Family doctor asking if they've got health insurance that they cannot afford, that there's 4 of them that need to see 5 different specialists, but the public system doesn't have the resources for that. Rather than critique the system itself, which we can do at length, how do you think someone could address that in their submission? What are some of the key things that will be useful to bring out?
Kia ora, Josh. It's the story of many of us out there. A submission is really important that you keep it short and to the point. And what you've raised is a very important issue. Now, you can do your submission creatively. You could do it as a video. You could tell the story. Keep the submission in writing really short, but ask to present to the select committee and tell your story. Tell it from your heart, tell it from your truth. And I'll tell you now that the best submissions that politicians ever hear are the ones that are creative, that wake them up because they hear thousands of them, and you can hear 1 or 2 of them snoring sometimes. So what you got to do is you've got to punch them right in their soul heart, that they feel it. And then they won't forget your story, and that will be the one that will influence them in their decision from that submission. That's my take on it anyway. I like to give them tears. I like to make them cry, and I have actually made politicians cry. Believe me, I didn't run over them in my wheelchair either.
Kia ora whaia.
Kia ora. I've got a question here that's specifically for Rawiri. So I thought I'm just finding it. And just a reminder, if anyone's got questions, please push the Q&A button because it's hard to find things in the chat. So, okay, I'm still looking for it. Someone has asked, what does it look like? You made a comment about giving, hand it back to Māori. I think you were talking about the resources for our health and wellbeing. So if someone's making a submission, they want to either as a Māori speak on their own behalf or as an ally speak to this kaupapa, what do they need to say? How do they capture that?
You know, that's a really good question, because that's a question that's been posed to me on a number of occasions. What does it actually look like? It's really, you know, at the end of the day, it's either the hapu, the whānau, or the iwi, or hapori, taking responsibility both for not only prevention, treatment and care of our whānau in the ways that we know how that's done. For example, in the north, I was having a kōrero the other day with Helen Moiwaka Barnes, and she was telling me that the initiatives that are being developed in the far north around waipiro, alcohol, admittedly, about how whānau can take on that responsibility of developing the initiatives themselves, developing the initiatives themselves, and actually playing the major role in that prevention and rehabilitation of our whānau. And you know what? That's not unusual to us as a people. For heaven's sake, we were doing that long before. Indeed, even after the settlers arrived here, we were looking after our own. What the Crown has to do is to fully resource our whānau to be able to take those responsibilities on. I really think that we as a people no longer want to continue to surrender to Pākehā models. I think that's fair to say that. So it's developing. You know, what is unique about your hapu, your whānau, your iwi? What's unique? And how do you fellas see this actually playing out if you were given that opportunity, and couching your submissions around that? And I think, you know, I take on the point that Takutua Hu has said, you know, make them cry, give them some live examples of the harm, whatever that harm might be, and then come at them with, well, this is the only way this is going to stop. Resource us as a people to pick that up. You fellas have failed us. Let us do it now.
Kia ora. And coming to you, Boyd, what's your take on your inside the health system, and what's your take on what this bill could potentially do, and what do you think of the priorities?
Tēnā tātou anō. Good questions. Part of the current health system has entrenched a lot of inequities, and it's entrenched a lot of privilege. And a lot of that privilege is afforded to the people who designed that system, and that's not Māori. And so this is an opportunity, if it's done well, and there's probably a few tweaks that I can see might be able to achieve it better for us. But if this is done well, I mean, essentially we start at the end point, which is we want our whānau Māori sitting at home. They're well fed, they're watered, they are well, and when they're not well, they recognize that they're not well, and they're able to instantly access a high level of service to support whatever that unwellness is, to bring them back up And that service will also look after their whānau, because as you know, if one person is unwell, it impacts on the entire whānau. So that's the end goal. And if we work backwards from there, then we identify all those barriers. And when you identify those barriers, it allows you to resource the iwi providers, the Māori providers, the community providers, the hapu, the iwi, provide them with enough resource and assets and authority, because oftentimes we'll have the resource and we'll have the assets, but we don't have the authority to make significant change that impacts on our whānau. So when you identify those barriers, you're able to have the resource, have the authority to make the change that is going to keep that whānau well. And not just well, for so long, our health sector has been tied down with putting out fires for whānau, and we've been battling one symptom to the next, and we need to move to a space where actually we're at a place where we get our whānau well. Now it's time to look up and look at the stars and imagine the progress and imagine the possibilities for them. We're not just talking about the absence of illness. And so there's a few things that I think need to, in order to achieve a greater level of autonomy for Māori. I don't know if we're at that stage yet, but some of the bill proposals, like when Māori spoke to it in 2018 and 2019, we asked for an independent Māori health authority, not one that sat under the Ministry of Health. We wanted our own. And so that's just one level of change. There's a few others that we can talk of, but that's essentially what we want to do is and also we need to, there are answers within our iwi, within our stories, within our hapu. And if we give some actual resource to that and some infrastructure, that's just not just people, but buildings and materials and resources to further research, why we were so well prior to the arrival of Pākehā, why we had such good relationships with our tamariki and our wahine, and why we respected them, and we entrenched that, reintroduced that back into our, not just our health system, but our life. Then that will have a good commentary and a good base for us to reintroduce our mātauranga, to share it. And as Leone Pihama says, Pākehā deserve to hear our beautiful stories too. Pākehā deserve our science, Pākehā deserve our mātauranga. And they all deserve to understand that whakapapa, as she says, it doesn't just go 4 generations up and down, it goes 4 or 5 generations across as well. And so there's all these wonderful things that we have the opportunity to share and uplift, not just Māori, but the health of non-Māori in this country. And we just need the opportunity. As Dr. Who said, we only get, even less than 1% of the overall health budget is afforded to Māori health providers. And that's an insult. It's an absolute insult to us. It's an absolute insult to themselves. They're doing themselves a misjustice, because then they have to build buildings and train others to look after our own wellness. And so it's unfair on everyone. And if we could resource it properly from the start, and we can knock down some of those barriers earlier, utilize our own stories and all of that sort of stuff. So utilizing our whenua, our stories, our resources to build a sustainable solution, not just to our health issues, but to our being. And I think I'm raving, but that's kind of my credo. And there's a little bit more to go on about the specific stuff within the Pae Ora bill that I think can be strengthened. Some can be lost. But and in terms of the submission, I agree. For our whānau, it's just writing a letter. It's just telling a story. You don't have to write letters. You can do a video, but it's talking to their hearts. You can leave all of the stats and all of that, the statistical kōrero to the health providers, boring health providers like me. We can do all that. Whānau can just speak from the heart, and we can provide the evidence and the stats that prove what they're saying is true. But I encourage our whānau, they don't have to worry about the stats. They're not paid to be there and offer a statistical analysis of why they should be well. We can do that. They just got to talk about their own stories. And it's just like a letter to anyone else saying, hey, we need to fix this, and here's some solutions. That's all. It's as simple as that. Kia ora.
Kia ora, Ewa. Kia ora, tautoko.
I have a tricky question for you. Okay, so this is from Heather. Kia ora, Heather. Could you illustrate for us your vision of how it would look for a young woman with breast cancer diagnosis who will require surgery, radiotherapy, chemotherapy, and how would the journey and the people involved be different with how it could happen now? I mean, partly it's what would be our vision of how different it would be, Because if we were going to do a submission, we'd say this is what we hope that how this will be handled.
Well, this is something that's actually been part of my whānau journey. We have the BRCA gene. Every single female in our whānau has had breast cancer. I've had 3 doses of it. We're used to it. But I can also tell you, it was extremely hard for me as an adoptee, and as my siblings all live overseas, apart from one sister here that I've since met who was also adopted. It's been a difficult journey to even get onto the books. I've experienced racism, sexism, disableism. I've experienced ageism. I've experienced the whole lot in that entire system. So let's look at the scenario. If we were to, one of the things we need to be doing, now I nursed under old-fashioned matrons. I nursed under the old school nursing back in the day, and I've nursed under the modern system. I still think the older system was better with some of the modern knowledge maybe today. But if we go back to the system, primary health care is what keeps people out of hospital, out of the tertiary healthcare sector. So you have 2 levels, primary, which is grassroots, GPs, front face, clinics, all of those, and tertiary, which is hospital, cancer treatment, intensive. If you are to fund enough money into the primary sector, you will reduce the cost of the tertiary level costs. So for instance, if we are to teach our children as babies and guide them through with their parents, it will take 2 generations to make a change, by the way. But if we were in South Auckland here, obesity, big issue. And obesity also can lead to things like breast cancer as well for some. So it's relevant. And diet is very relevant. If we were to teach our young children right from primary school right through about healthy eating, how to grow a garden, healthy kai, how to look after yourself, taught them why we make them run and do exercise, because I know I was one of the biggest moaners. I absolutely hated putting those bloomers on because we didn't need decent shorts back in the day either. We had to wear round bloomers. So you can imagine I fought that all the way. But if we were to teach children why exercise is important, why it's important to love yourself, to look after yourself, why it's important to have a balanced diet, then what we're doing is we're starting a primary healthcare model. So in the old days, when I was growing up, when many of you here were, we had karatani nurses. They would go in at the very beginning, and if you had a baby that was disabled or sick, had colic, or you had twins, or you had sickness in the whānau, they were identified, and those karatani nurses got in there, and they would often even stay with the mum with twins or with a sick baby. If mum, say, had a cesarean, needed more time, then they were in there like nannies, and they would go and look after that. I was going to be one, but then they got rid of them the year I started, so I started enrolled training. Those karatani nurses kept babies out of hospital, okay? Babies with preventable illnesses. Yes, they vaccinated them even. I mean, vaccines didn't even exist when I was a baby, so I saw lots of disabled friends at school, deaf, blind from preventable vaccines. The karatani nurses were able to pick up if there were problems, if mum was having postnatal depression, if there were problems there that they couldn't manage. And that's how they broke that down. Now, there were stigmas as well. My father was also, my adoptive dad was a social worker and used to come home with tales of where, you know, in those 70s, those men, they wore their short work shorts with the socks and the sandals and the short t-shirt. Well, he'd come home and he'd say he looked like he was wearing trousers because his legs were covered in fleas, black with fleas. Those were in the houses back then. In other words, he went into some of the poorest of the poor, which is not like what we see today, but what they were seeing back in the 1970s. And primary healthcare was getting in there and actually assisting whānau and giving them a hand up. What we're doing now is when structuralisation came, we actually, when we put user pays on the Ministry of Health, we took away the universal healthcare as we knew it. Today, I pay thousands a year just for basic equipment to keep myself well because they won't pay for it. I can't afford it anymore. You know, we can't afford even medicine. Most of the medicines I take are not subsidized. So I pay $1,000 a month for one that I can't afford, haven't had for 6 months, and I'm slowly deteriorating and progressing as a result. I pay $22 for another, 100 here, 100 there. It adds up. What we need to do is re-indigenize the health system. If we were to bring, there is a need for Western medicine, don't get me wrong. But going back to for example, I go in every year, I get a mammogram, right? That was denied for years. Under this new system, if we were to re-indigenize and using the Western knowledge, the things that do work for us, but traditional knowledge where we know that works for us, you would find there'd be a good balance. I can go in knowing I can have karakia beforehand, go and see a tohunga for some of my stuff that I might need, and then I go in and use the Pākehā system, what I need, which is the mammogram. When I get a lump, I might need to have a tri-cut biopsy again, and then I need to have that little vacuum they use and draw out all the bone and stuff that's in there, all the lump that I get. And with the healing, one time I had a scar that wouldn't heal. It was infected. And so it took 6 weeks. It took 1 weekend of manuka honey from a tohunga and it was gone by the Monday. Even the district nurses couldn't believe it. So there's a knowledge in both systems that's important that we don't get rid of. And there's very good knowledge. In other words, someone said to me recently, use Pākehā medicine for Pākehā ills. Use Māori medicine for Māori ills. And we do have Māori ills. We have things that work better with our traditional medicines than with Western medicine. Even going through chemo, traditional medicine has benefited a lot of my community when they're going through chemotherapy, diet and traditional. Hence why I say, if we were to strengthen our primary care, re-indigenize our health system, bring those two in complementary to each other, we would have a better outcome. It would mean that those young ones going through with breast lumps and stuff can be seen in a timely manner. We've got to remove racism though, for that to happen. And that takes time. We have to bring more Māori and other nurses, doctors through. That takes time. We need to have a better knowledge about how both work and have teams working together. One of the biggest problems we have with our health system, they work in silos. So for instance, to treat me, I have a neurologist, a urologist, an immunologist, proctologist, I think that's what they call the ones that do the colonoscopies, a gastrologist. I have every ologist you can find, and yet they don't talk to each other, and nobody has yet been able to solve what's going on because they don't talk to each other. So we need a more consensus-driven, Māori-driven, more Indigenous, holistic-driven process in order to get a better health system, I believe, in Aotearoa.
Kia ora. Thank you so much. Now we have 3 questions coming up. Now Jerry has said that frankly, the system does not work for Pākehā or Tau Iwi either. How do the members of the panel feel about promoting the Māori way for all people in Aotearoa?
Happy to say. That's what Whānau Ora currently does already. Whānau Ora is not restricted to looking after whānau Māori.
Kia ora.
You know, there's no restrictions on that. It's just a Māori model of health that's available to everyone. And that would be the same with any Māori health authority model or design. All the models work for everyone. Just because you don't believe in Papa Tuanuku doesn't mean she doesn't look after you. Kia ora.
Love it. Love succinct. From Adam, do we recognise that this bill is a step in the right direction but doesn't go far enough? If so, how do we make our submissions in a way that gets this kōrero across? I might like to start on this one. When you do your submission, as Dr. Hu was saying, it can be brief. Make sure you say you want to speak to it. But I always say, introduce yourself properly and say, why are you writing this? Why is it important to you? Because that is the core thing about what makes it genuine. Because health has affected us all. And if you're Māori, then you have got people who have died young in your whānau, full stop, and who have died unnecessarily from preventable things that our health system did not provide. So, but always say, and we are recommending that you do what you support. So yes, we support having an independent Māori authority. However, here's some concerns about that thing.
Mm.
So always push the government, always. You know, the Greens had it as part of our policy. We had it as our campaign priority to have an independent Māori health authority. That as long as something was a little agency inside a government department, we're never, ever going to have any hope of rangatiratanga. And so this was a critical thing that had to happen. So it's great to say what's good, and then feel free to slam them. Go, you know, whatever detail and say, well, these are the issues. There is a thing whereby all clinical staff throughout all the hospitals keep their jobs, keep and stay in their roles. Now, if you're restructuring a racist system with all the same people, how do you make sure then that the same behaviors, decisions, the discretion that was used in certain ways is not just reproduced and just in under a different name in a different system? So if those things have happened to you, if that's part of your personal experience, tell those stories and say, how do you make sure, and ask them, challenge them to give those answers. So I'm just going to keep on moving. Would we be able to get the doctors who blatantly ignore information on patient files or imaging studies like MRIs? Oh, where did that just go? Disappeared in front of my eyes.
Apologies, I could answer that one straight away.
You go.
Take them to Health and Disability Commissioners Code of Rights Act. I sit on the Human Rights Review Tribunal, and I'll tell you now, if it gets to the tribunal, we will listen. We have chastised so many who have treated our communities with disdain through some of the treatment. And so, you know, people don't utilize that. People go, how can I lay a complaint? It's simple. We have a code of rights, 11 rights out there that you're entitled to. One is to be heard, one is to be informed, one is to be treated with respect, one is to be communicated with properly, and one is to be given the right supports as needed. So, and there's a whole lot more there. So go to the Health and Disability Commissioners Code of Rights site and exercise your rights as an individual and as a whānau to take a case. I watched a mother, Māori mother with a disabled son, no lawyer present. She represented herself. And I have to say that doctor was extremely aggressive and very nasty. But we have to listen to both sides of the evidence. That mother held her composure. The doctor's lawyers made us bring in the court security because they said that her and her whānau would threaten them. Well, after half an hour, I talked to the chairperson of our committee, of our panel, and told her to get rid of that security because all that was doing was stigmatizing that whānau. And they quietly got rid of security. No one said anything. Nobody got violent. Nobody got angry. Nobody raised their voices. That mother presented the evidence. So she did the job, and she did a brilliant job. And it went in her favor because that doctor did not do the basics. That's why she was so angry. So take it to the Health and Disability Commission. If the negotiations don't go well, bring it to the tribunal. We listen, and I can assure you we do.
Kia ora. I'm just going to read out Lisa Te Morenga's point about she has been perusing the submissions that have already been made. Everyone that she has read is completely against the establishment of the Māori Health Authority and quite racist. How seriously are these submissions taken? Is this why we need to submit? So the government has put the bill, which means generally what's in that bill is generally what is going to happen. We are way down the track. So no matter how many racist people now do submissions, that will not change. So, and this bill will go through because the government has the numbers to do it. How the Greens are supporting it, I'm not sure what the other parties are doing. So what we can do with these submissions is raise particular issues related to Māori health, related to whakapāpui, related to the communities that you're involved in. And because it may be you may be Māori yourself, but or you're an ally, but you're involved, whatever are the communities, those are the ones you speak for when you do your submission. And just a reminder, thank you, Rosemary, that the Greens have done a submission guide. Really important. Cut it, read other things, say, oh, I agree with that. Cut and paste little bits of it. Never copy a whole submission. And even our submission guide, do not cut and paste the whole thing. because if you say you want to speak, it's actually part of how Parliament works. The Select Committee must hear from you, unless they decide that they can delete your ability to speak. And the number one way to do that is if you've done a cut and paste. If you've just done a format, what do they call it? You know, a form letter, a form submission, boom, it's gone. It doesn't matter if there's 20,000 of them, it counts as one. So make sure your individual voice gets heard, make sure you do an individual, and even if it's just 5 lines, so long as it's your words, and feel free to get ideas and use the other ways of looking at things, but use your kaupapa, your thoughts, what's important to you. And I'm going to throw out to the panelists, what are your thoughts about the Māori Health Authority sitting at the same level or where it sits with health in relationship to Health New Zealand?
I can have a quick chat. Yeah, and so I know for a large part of a number of people who asked for some form of Māori Health Authority, the ask was for an independent Māori Health Authority, one that didn't sit under the Ministry of Health. So that's the first challenge we probably have to address and understand the authority and the devolution of power that will occur to the Māori Health Authority. And so if we get some clarity on that, I know there has been some, because there will be a lot of submissions that are against it, because there are a lot of non-Māori who feel that any extension of authority and resource to Māori impacts them. But they're well, the majority are well. And so there's that famous saying that for those who have held privilege, the thought of equity feels like oppression, or something clever like that. Someone clever said, I don't know exactly what it is, but that's what's happening, and that's what will be reflected in many of those submissions, especially from the non-Māori collective, of which they are the majority of our whānau in this country. So I would not get too disheartened, because the content will be the same. It will all be from a Hobson's Pledge template. And I don't think there's no evidence to support what they're saying will impact badly on their health. And so this is an opportunity to have some real positive narrative about our health system. It's not perfect. There's a little bit of, I don't get normally hung up on words and wordsmithing, as long as I can sort of see an honest attempt, but there are some words in there in terms of the responsibility of the Crown, whether they should or whether they will acknowledge the treaty, acknowledge our partnership. And so there are some words in there that are detrimental to the treaty relationship, I think, and people might need to flesh some of those out. There's missed opportunities, I think, in the bill, where, as Rawiri shared, they get over 1.5, 1.2 normally, around that sort of area of funding from the alcohol levy. And for so many years, that alcohol levy has been distributed to non-Māori groups who Māori have to go to on our hands and knees and write a submission and write a request for funding to get funding to have a reinvestment that will alleviate and stop the harm that's happening caused by alcohol. And so it's real backwards. It's real backwards. And so there's an opportunity to ask for that funding to be directly reinvested into Māori. And Māori can make a decision on where that's disseminated and distributed. I think there's a missed opportunity to call Whāmek into consultation or into accountability for iwi and hapu and Māori. I think there's some good opportunity for the Māori Health Authority to have some say on the Health New Zealand mahi and proposals, and there's an opportunity to veto some of that mahi. And people think that veto means that we'll be vetoing everything. That's untrue. It makes no sense for Māori to make non-Māori unhealthy. That's not our goal. That's not our aim. And so there would be no vetoing of things that would impact negatively on the entire country. The focus is on equity. And that's one of the real struggles that I find our non-Māori whānau are trying to gauge and understand is, does equity for Māori mean harm for non-Māori? And we have to every day, every week, every month, every year, we have to have this argument with our Pākehā whānau that no, it doesn't. This is not. And if Māori are healthy, then it uplifts the entire country, because at the moment we're spending money on unhealthy Māori, fist over fist, where we
Kia ora.
could be spending money on Māori development, on non-Māori development, and progressing ourselves.
Kia ora.
So I think this is a good opportunity. I think, as I said, those are some of the gaps that I know. There will be more. Like I said, I'm not a wordsmith and I'm not a great academic, but I think I know it can be disheartening seeing many of those non-Māori submissions, and my advice is don't read them, because you know what's going to be in them. Don't read them, take it as read, and then just do your own submission and focus on all the positive stuff that you can suggest and bring to the kōrero. Kia ora.
Kia ora, Boyd. Tēnā koe, te tuakana e Boyd. I want to pick up on a point that Boyd has made, which is absolutely relevant, and that's the independence of the Māori the Health Authority. I had a bit of a debate. I was going to say a punch-up. Well, a debate with one of the officials who played a hand in putting the draft bill out. And I raised the question, so the minister has the right to sack a board member or the board. So it comes back to what Boyd was talking about, the independence, not being under the Ministry of Health or Health New Zealand. At least that, for me personally, and certainly for whānau that I've spoken to, is what they would prefer to see. Totally, divorced from the Ministry of Health or Health New Zealand, and also the Māori Health Authority being given that authority to have massive oversight powers and have input at the front end and all decisions made by agencies, and those agencies, either directly or indirectly, who haven't direct or indirect, whose decisions have a direct or an indirect impact on Māori. So, what Boyd has actually said, I tautoko, because, I've just been ticking off the box here. Oh, yeah, we agree with you, Boyd. Ai, kia ora, bro. So, ai, ka pai tēnā, kia ora.
Kia ora. I want to just pick up on a couple more questions that have been raised. Janelle just saying, are we too far down the track that our concerns won't be heard because everything is in motion? Absolutely not. The bill only had its first hearing. And so what it does then is it goes out, does the submissions, then it comes to the select committee. I'm on the select committee. We will listen to all of these, read all the submissions, listen to all the hearings, and then we write our own report. Now that report details what changes to the law we suggest. And so the more your submissions that come in to support a particular thing, the better. And we, in every select committee I've been in, we have almost always changed something, and sometimes quite substantially. The bigger the law is, the more detail it is, the more likely you're going to need change. And so we help tidy it up, and we try to do that in a bipartisan way. Okay, just asking again, can the select committee reconsult? No, that is the process. Once the report is done, boom, select committee's job is finished, comes back to the House for second reading. And so there could be a review potentially of the law later. That's tricky to arrange. We want to try and front end this. And also I just want to shout out, somebody put a link about a hui tomorrow, 10 a.m. Hapai te Hauora, hosting a national Zoom session with Māori providers. Amazing. Want to do a submission. They've said that they're going to produce a template. I want to reiterate, do not, if you add your name to someone else's letter, that's fine, but it only gets counted as one letter. It's better to take out bits of the template, bits of the thing, and write your own. Otherwise, your voice is gone. Okay, and I really want to emphasize this, and also to whoever's going to be part of that, we don't get trapped into thinking we've got 10,000 people signed our thing. It's one submission. Okay. That's what will be counted. Get the 10,000 voices, because our numbers are very, very low. So so happy this is happening. If anyone else can jump onto that. We've got 4 minutes till we finish. I'm going to give the last word to Dr. Who before I close our hui.
It's dangerous.
You've got 2 minutes max.
Thank you. I just want to say, you're absolutely right, Elizabeth. It's about how that submission's done. It can be quick, can be succinct, be creative, wake them up, stop them snoring, make it stick. But be positive. I always try and put solutions to the questions I pitch to them. And that's a really important part. But I just want to say something here. As a whānau hawa, or what they now call mana whaikaha, as huhana, the issue I have is actually around the fact that the Health and Disability Review report excluded Māori, excluded disabled completely. And when I asked Helen at the time when I was on the WEAG committee, she laughed at me and walked off. And then when I saw that disabled weren't mentioned until page 150, and that disabled Māori were excluded even further, it just shows how far we've got to go to bring about an inclusive society. One of the issues that remains is I'm aware of some of our Māori providers are now saying exclude Māori disabled because we have no equity with Māori. Apparently being disabled means we are not equal. Now that is rubbish, and I'll tell you that right now. I have tino rangatiratanga and I have mana motahaki. Collectively behind me is Hauora Māori saying we are equal. We are equal to all Māori. And if we look at our immortals, Muri Mahuika, goddess of fire, was blind. Murirangi Whenua was blind, deaf, physically disabled. Maui, clubfoot, bit of a haututu, so probably ADHD. Didn't have fetal alcohol back then because it didn't exist. But, you know, he had neurodiversity clearly. And they all achieved some of the most amazing things. So whānau, let's not get into dividing between Hauora, Hauora, but bringing it together as Māori did in the past, and we can do again. And this is part of what the problem is. If we're not funded equally, if they're not given powers of decision-making equally, then it's just another piece. And until we re-indigenize, I'll say again, until we re-indigenize our health system to recognize all systems that work for us within this one body, we're actually going to have something that will fail. But it's up to us to make it work. And the only way you can do that, bring your voice to the submissions and get heard. Now, Pae Ora is simple. 3 strands: the individual, the whānau, the collective, and the environment around us. If all 3 can be healthy, we've got a healthy Aotearoa. And we can do that together, regardless of where your whakapapa comes from. We're in Aotearoa. Let's make Aotearoa the best that we can. Kia ora.
Kia ora. Thank you so much. Thank you. Boyd Broughton, Rauri Ratu, Huhanahaki. You are all amazing. I so appreciate your efforts here. Quick things in the chat, please. There's a link to our submission guide, 9th of December. That's very close. It's better to put in a 5-sentence submission that you finish than your 10-page one that never gets in. So just put something in. And for Alice, who's just done a last-ditch question about Pharmac, it will be considered outside scope, but I think everything that we refuse to allow them to silo everything about health. We bring in people with disabilities, we bring in mental health, we bring in Pharmac, absolutely, because they are so connected to much of the inequality of our people accessing medications. So you write about what's important to you, just get it done. So I'm going to close then. I often will use whakatauki to close my hui, and one of my favorites is ma pango ma whiro ka oti ai te mahi. With the red and with the black, with our combined efforts, with our knowledge, with our passion, with our kaha, we will get the job done. Thank you everybody for coming here today. I look forward to reading your submissions and hearing you speak in front of me. Kia ora.
Ngā mihi.